consultant pediatric neurologist at the American Center for Psychiatry and Neurology, and today I'm going to talk a little bit about cerebral palsy. By definition, cerebral palsy is an umbrella term used to describe a group of disorders that impair control of movements and posture due to damage to the developing brain. The problem in movement and posture arises following an injury or an insult to the developing brain of the child. This injury could be before birth, during birth, or after birth. And the insult could be in the form of infection, reduced blood supply to the brain, toxins, or trauma. The severity of the extent of the disability could also vary depending upon the nature of the insult and the region of the brain involved. By definition, it is a non-progressive disorder, that is, it does not continue to worsen throughout life, but the symptoms change over time, sometimes getting better and sometimes getting worse. We should be aware that 70% of cerebral palsy is due to brain injury during baby's development in the womb. It may not be detected at birth and will come on in light maybe later on at times. Majority of the times the cause of the brain injury is not known, but usually intrauterine infections, toxins, reduced blood supply, placental problems, etc. cause this. 20% of the cerebral palsy is due to brain injury during birth process, and prematurity related brain injury is also possible. Hypoxic damage during birth in term babies is another common cause. Whereas 10% of children with cerebral palsy have cerebral palsy because of an injury that was acquired after birth, following meningitis illness or encephalitis, trauma, or hypoxia. Now, children with cerebral palsy also have a lot of associated problems, or what we call as comorbidities. About 35%, 50% of children with cerebral palsy have seizures and different levels of learning disability, or problems with vision, at times problems with hearing and language. A special mention here should be about premature babies. Premature children are particularly vulnerable due to their fragile and immature brain. Any variance in blood pressure, infection, or hypoxia in this period can lead to a significant brain insult, leading to cerebral palsy. The usual form is a spastic diplegia, that is, stiffness of both lower limbs with a typical involvement of brain areas, which is visible on the MRI scan. A point of note is also that no one child with cerebral palsy is the same. Every child is very different. The incidence of cerebral palsy is about 1 in 400. So, as in the UAE, there are about 80,000 births in a year. And therefore, in the UAE alone, every year we have about 250 children with cerebral palsy. How do we classify cerebral palsy? Cerebral palsy can be classified based on severity in different grades. It can be classified based on the part of the body that is affected, like quadriplegia, meaning full limb involvement. Hemiplegia means one side of the body is involved. Diplegia, meaning both legs involved. Monoplegia means one limb involvement. And it can also be divided based on the type of posture or movement problem that the child has. Like 85% of children with cerebral palsy have a spastic type, that is, stiffness of all the limbs. Some children have what is known as ataxic cerebral palsy, that is, the movement is not controlled. Some have aphatoid cerebral palsy, that means they have additional movements on top of their usual movements. And there is a very rare form, which is the hypotonic cerebral palsy, where they have flaccidity or looseness of all the muscles. What is crucial is how cerebral palsy is diagnosed. It is diagnosed usually very early in infants who have known risk factors for typical presentations, like extremely premature babies or children who suffered severe birth hypoxia or reduced oxygen to their brain during delivery. Usually pediatricians or neurologists follow up these children very closely from birth to look for the early signs that might pick up spasticity, that stiffness, or movement problems. Most of the children with cerebral palsy are diagnosed during the first 2 years of life. But if the child's symptoms are very subtle, it can be difficult for a doctor to make a reliable diagnosis before the age of about 4 or 5. Doctors will order a series of tests to evaluate the child's motor skills. Usually during regular visits, they will monitor the child's development, their growth, their head size, muscle tone, age-appropriate motor control, hearing and vision. And they will do this to rule out disorders that sometimes mimic cerebral palsy. And although the symptoms of cerebral palsy may change over time, it is not progressive. If the child is continuously losing motor skills, the problem more likely is a condition other than cerebral palsy, such as a genetic disorder, or a muscle disease, or a metabolic disease, or a tumor in the nervous system, and it has to be evaluated very closely. Lab tests can identify other conditions that may mimic cerebral palsy, and some of them are MRI. If I want to scan a child's brain, the best modality to do that is an MRI scan. MRI is a computer-based test with a magnetic field and radio waves to create an anatomical picture of the brain's tissues and structures. It shows the location and the type of the damage and gives finer details as compared to a CT scan. If a child with cerebral palsy has seizures or fits, an EEG or electroencephalogram is asked or ordered for. What happens in this is they put a series of electrodes or stickers on the head of the child to detect electrical activity of the brain. And what we look for is abnormal electrical pattern. Sometimes blood tests are requested to rule out conditions that may mimic cerebral palsy. Let me just touch briefly on management, as that's something that is very essential for parents to know and be aware of, and even for therapists that collectively look after a child with cerebral palsy. It's important for them to share knowledge and experience. So there are various specialists involved in managing a child with cerebral palsy effectively. Usually, the management of posture and movement is at the top of the list. And the professionals involved with this are the neurologists, physiotherapists, the occupational therapists, orthopedic surgeons, and the orthotists. And usually, when children have cerebral palsy in the early stages after their birth, they're quite floppy when picked up. They cannot hold their head, and then later on start developing stiff muscles and unusual posture, and their development milestones are delayed. Some children have a very severe form of spasticity or stiffness, some have less, and this determines the difficulty in movement. Some can have other type of movement disorders like dystonia. It can present in one part of the whole body. Some have what is called as athetosis. It's a slow writhing movements of the whole body. Some have ataxia, which is clumsiness or imprecision or incoordination when attempting to make a movement. And some have a mixed form, a combination of these movement disorders. So usually the health professionals conduct an examination to pick out these problems and provide a strategy to help the child. Going on to treatment, we have to be very clear. Cerebral palsy cannot be cured because the damage to the brain has already occurred and that cannot be reversed. But we have to remember that cure is not the same as treatment, or treatment is not the same as cure. And although we cannot cure a child with cerebral palsy, we can definitely provide treatment to improve that child's capabilities. So the earlier the treatment and management begins, the better chance that child has to overcome developmental disabilities or learning new ways to accomplish the tasks that challenge them. The treatment may include physical and occupational therapy, speech therapy, drugs to control seizures, relax muscles, and alleviate pain. It may include surgery to correct anatomical abnormalities, or release tight muscles using braces and orthotic devices, wheelchairs, rolling walkers, and communication aids such as computers and sometimes voice synthesizers. I have to say that many children go on to enjoy a near normal adult life if their disabilities are properly managed. There is no standard therapy that works for every individual with cerebral palsy. Once the diagnosis is made and the type of cerebral palsy is determined, a team of health professionals will work with the child and their parents to identify specific impairments and needs, and then develop an appropriate plan to tackle the core disabilities that the child has. And that's mainly to improve the quality of life of the child. Now, if you just touch on the physiotherapy aspect of it, physical therapy usually begins in the first few years of life or soon after the diagnosis is made. And it's the cornerstone of cerebral palsy treatment. And there are specific sets of exercises like resistive exercises or strength training programs and activities which can maintain or improve muscle strength, balance, and motor skills. The main aim of all this is to prevent contractures, that is, permanent stiffening of the muscles. The other aspect is the occupational therapy, which focuses on optimizing upper body function, improving posture, and making the most of the child's mobility. The occupational therapist helps the child to address new ways to meet everyday activities, such as dressing, going to school, participating in day-to-day activities, and so forth. The third and the most crucial part to the whole management strategy is speech and language therapy. It improves the child's ability to speak more clearly, help with swallowing disorders, and they learn new ways to communicate if they cannot speak, that is using sign language or special communication devices such as computers with voice synthesizers, and sometimes using boards with symbols of different objects and activities to which a child can point to indicate his or her wishes if they are severely affected. And one of the main areas to look into in child with cerebral palsy is their problems with eating and drooling. Because they have little control over, or many of the children have little control over their muscles that move their mouth, jaw, and tongue. And they're also at risk of having aspiration, that is, a risk of breathing food or fluid into the lungs. Also malnutrition, recurrent chest infections, and prolonged lung disease, and all these needs to be followed up and looked into very closely. Going on to medications, usually the medications in cerebral palsy are used to manage spasticity. So some of the medications we use are called diazepam, atropine, dantrolene, dizanidine, and so forth. And there are side effects to each one of this. And clinicians that use this should be aware of the side effects and monitor these. We sometimes use botulinum toxin, which is an injection which is injected locally into muscles. It has an effect for about 3 months to relax the muscles so that the physiotherapist can do their best job. And it has to be repeated. It's a form of toxin which has been deactivated. It does not have any systemic effect, that is, it doesn't cause any effect all over the body. It is specifically for the muscles where it's injected for. Other modes of newer therapies like intrathecal baclofen, where the medication, which reduces the tone in a child, is put in the device which is implanted around the spine, and it continuously delivers a dose which can be sent from the outside. And it's a muscle relaxant. Then sometimes surgery is carried out, orthopedic surgeries to lengthen the muscles which are stiff, or tendons which are stiff. Sometimes the spinal deformities, the curvature of the spine, which gets worse with age, are also corrected by surgeries. In some centers, they use what is known as selective dorsal rhizotomy. It's a very technical term, but what it means is if children have severe spasticity and when all the form of treatment has failed, then the nerves can be irreversibly disconnected. What has to remember is children with cerebral palsy not only have a problem with their posture and movement, but what has to be remembered is the other effects because of their brain injury, like managing their epilepsy, managing the problems with incontinence, special exercises, their feedback, drugs and surgery, managing the bone health, because they are very prone to have osteopenia and they're born to have broken bones, and that's what needs to be looked into. And also pain, which is neglected very often. It has to be identified. The muscle spasms needs to be treated, and some of the medications like gabapentin or diazepam needs to be used appropriately. So this is about cerebral palsy in a short period. I will try and put up specific videos for individual treatment modalities or individual medication use in the future.